In this quick tip video, which is unrelated to electronics, I am going to show you an excellent money-saving tip which can be used by millions of people who suffer from outer ear infections. If you are like me and greatly enjoy water sports, swimming, and diving, then you may have had an outer ear infection in the past, or you may have had an outer ear infection due to showering or taking a bath and not drying your ears. Outer ear infections, also known as swimmer's ear, can certainly make you feel miserable and ruin your day. On YouTube, you may see videos showing how to cure an ear infection naturally, but unfortunately, many of these methods rarely work based on my experiences. We also have the problem that many people may be unable to see a doctor due to a lack of money or insurance, or they are in a remote area which lacks medical facilities. The remedy which I am about to show you is also excellent for survivalists. The first thing I would like to do is show you how I know when I have an outer ear infection. If you feel pain as you gently tug on your earlobe, downward and outward, or if you press on the tragus, which is the little flap that covers the ear opening, and you feel any pain, then usually that means you have an outer ear infection. You may also notice drainage from your ear, which is usually clear, along with a headache. Once confirmed by a doctor, that doctor will usually prescribe a drug known as Otic Suspension. Otic Suspension is an anti-inflammatory and antibiotic liquid in the form of drops which is placed in the affected ear 3 times a day and continued for a few days after all symptoms have cleared. I'm going to show you how you can make essentially the same prescription-only drug using products available over the counter, which many people already have in first aid kits. First, we're going to take a look at the ingredients in the prescription-only Otic Suspension eardrops. Now, this is a 10 ml bottle, and in this bottle, it says each ml contains neomycin sulfate, 3.5 milligrams, and it also contains polymyxin B sulfate, 10,000 units, along with hydrocortisone 1%, 10 milligrams. In order to make this, you're going to have to pick up these 2 ingredients right here if you already do not have them. The first one is 1% Hydrocortisone Cream. Keep in mind you want to buy cream. You do not want ointment. If you purchase ointment, you will not be able to mix it, and this whole thing will just be a mess. You want plain Hydrocortisone Cream. It doesn't have to have aloe like you see here. The other thing you're going to have to pick up is Neosporin Cream. Now you notice I picked up the generic versions because I didn't want to pay more money to have name brand. This is just as good, so be sure to pick up generic. Antibiotic cream right here, and if you look, it contains neomycin sulfate, polymyxin B sulfate, and it also contains an analgesic to help with pain. So we're going to take 1 gram of the antibiotic cream. Now keep in mind, it's not critical, the proportion, because you're going to have something that's similar but not exact to what's in the eardrops. So 1 gram is roughly, I've checked this already, right about there is about 1 gram. That's around 3/8 of an inch in diameter. If you made a ball out of this, you want to make it around 3/8 of an inch. Then you're going to take a smaller amount of the 1% hydrocortisone cream, and you're going to apply about that much. All right? Make it the size of a pea. You're going to take both of these, place them inside of a little plastic cup like you see here. Take this right here, scoop the 2 off together, right in like this. Okay. I used a Q-tip. You could use any little plastic drink stirrer. Whatever you use, make sure it is very clean. This is brand new out of the package. Now you see that this is a very thick mixture here. You're not going to be putting that in your ears, drops. So we're going to have to water it down slightly. So you're going to take some distilled water. Be sure to use distilled. Put a little bit at a time And you want to keep mixing until everything is dissolved. Alright. I actually added just the right amount there. It looks pretty good. You don't want to overwater it, and you don't want to put too little. If you don't put enough water, it's going to be way too thick, and it's not going to flow to the bottom of your ear canal. And if you water it down too much, you're not going to be getting the full strength of the medications in the liquid. So you want it just right. Just keep mixing it and mixing until everything is dissolved, until everything is blended together. And you want to do this for maybe 2 or 3 minutes. And if you notice it's too thick, then add a little more distilled water. It should be, when you move it around, it should flow. Alright, so this is actually slightly too thick. So I'm going to mix this a little more. It does flow, but it's a little too thick, so I'm going to add just a little more distilled water to thin it out a little better. And this looks good. Yeah, this will flow perfectly into your ear canal. You're going to mix this up until everything is blended together. What I do, once this mix is complete, like you see here, I'll take an eyedropper. I'll apply 3 drops to the affected ear 3 to 4 times a day. After about 2-3 days, I'll notice a great improvement in my ear. If after 3 days of using this you don't notice any improvement, then I suggest you see a doctor as soon as possible. If you enjoyed this tip, please rate it a thumbs up, subscribe, and post links to this video on other websites and blogs. Also be sure to check out my video playlist as well. Thank you very much for watching.